Welcome to another episode of Absolute Talks. I thought today we'll have a very special guest, Chris Love, our removables manager. Talk to us a little bit about Conus. First thing you probably ask is, what is Conus? It's a friction-fit denture held on by custom titanium abutments with gold precision caps. Chris, what's the advantages of Conus?
So you can restore Conus with or without a vestibule, and the cleansibility is very nice.
And for those patients who do not qualify for a fixed hybrid because they need vestibule support, or the clinicians might be concerned about cleansibility, this is a superb option. I will start by saying you need about 12 to 15 millimeters of vertical clearance. Best way to test that is take the patient's existing denture, just measure it or send it to us, we'll measure it for you, and that will give you a good idea if this will work. You've probably heard about some clinicians saying they've had a bad experience with Conus. What's your thoughts on that?
So Conus definitely is very technique sensitive. So we've actually developed a protocol manual. If you follow that protocol manual, we're having really good success with these cases now.
First appointment will be implant level impression through an open tray, preferably splint them together, and then send that impression to the lab. You'll create a soft tissue model. Put a bite trim on top of that and return it. Second appointment will be traditional bite set. Set the midline, set the bite, set the arch, return that, and then you can either do a digital or a traditional in wax tooth trying. Is that right?
Yep.
Clinician at the third appointment will set patient expectations, make sure the patient's happy with everything, and send everything back. Now this is where the magic happens. What do you guys do after the third clinical appointment with the case?
We then digitize the case. We get the Atlantis Conus abutments milled. We'll either make a milled Trilor substructure or a chrome cobalt cementing structure.
And the advantage of doing this with Trilor is we can then take the case and keep it in a digital format. So basically we're going to take this case, place it in the mouth, and this is our fourth clinical appointment. You're going to receive the case. You will have abutments in a positioning jig that we get from Atlantis, Dentsply Sirona. You'll place those abutments in the mouth, torque them down. You're going to place your gold caps. These are machined gold caps. And then we prefer, or we suggest, that you tap down these caps with the intraoral mirror. I always say 4 taps on the posterior caps, 2 taps on the anterior. You want to set the posterior cap slightly deeper. And then we place the cementing frame over those caps and lute them in place. We use Quick Up. And then we place the printed tooth try-in over that frame. And now we can basically have a prototyping experience with this case. We can prototype it, make sure everything is where it needs to be. Do some bite adjustments if needed, if there's any adjustments that you want us to change. We then send a new custom tray impression, so you can take a new pickup impression at this point and lift the frame and the caps off. Everything comes back to you then, and what do you guys do?
So then we will digitize this final step.
And at this point, if we're going to do it digitally, we're going to use something like Crystal Ultra, which is a nano ceramic, and that gives us exceptional aesthetics and added strength on these cases. So once we get everything back, the lab will now provide a sleep denture, which we mill out of PMMA material, and also a removing tool. You want to discuss the removing tool real quick?
Yeah, so the removing tool is just to help with getting the denture unlocked. The friction is so good on these cases when it's properly done that patients can't just pull them out with their hands. So we've actually made a removing tool that they're able to just pop one side at a time and it will
And the nice thing, like we said in the beginning, Conus actually functions like a fixed hybrid. And I think a lot of patients have told us the same thing. Best denture I ever had because it doesn't feel like a denture. So we invite you to restore your next case with us. Download your protocol manual at absolutedental.com. If you've got any questions, he's Chris at absolutedentalservices.com. I'm Conrad at absolutedentalservices.com. And we will walk you through this process step by step.